Right.
not long-term. So when an opioid is prescribed, how many pills are prescribed at one time? Can I go to the pharmacy and get a 90-day prescription?
Yeah. I wouldn't recommend that. I mean, and even if your doctor gives you a prescription for 14 days, if you're feeling great at 3 days, there's really no need to go ahead and take the rest of those medications, which is something as part of the opioid stewardship program that we're trying to work on at St. Bernard's, is encouraging physicians to really decrease the amount of opioids that they're giving their patients after, an illness or an injury or some sort of a surgery, just to make sure that. And if you do need something for a longer period of time, it's encouraging you to go back to your physician and say, something's still wrong here. I'm still in a lot of pain and I shouldn't be. So we're hoping that we can maybe encourage physicians here in the area to decrease that amount of time that they give patients those prescriptions.
A lot of the prescriptions we see are for 1 or 2 tablets every 4 hours as needed. And I think it's important to remember that we need to start with the smallest amount and work up as we need it. And that would be a way to take less opioids on for that acute illness or after that surgery.
Right.
Well, actually, you bring a very good point. I see a lot of prescriptions which are written 1 to 2 tablets every 4 to 6 hours. The difference is between 4 and 16 tablets a day. So patients will be justifiably bewildered by saying, between how many should I take? I think we would be very specific in how we recommend treatment, and we tell them take the least amount that's possible that will allow you to function through the day, and if that doesn't work, add another one and then another one, but allow at least 1 day to go before you decide to go a little bit higher.
I think something a lot of the general public doesn't know is that addiction to opioids can actually occur within 4 to 5 days, and so it's very important to just take the lowest dose for the shortest duration. And I think, what you alluded to, some of those conversations regarding the goals of treatment are very important to be sure the patients understand that the goal is not to get you to zero pain. The goal is get you to a pain level that allows you to function and do your activities of daily living. And then, sometimes that can be accomplished with plain old Tylenol and ibuprofen. You don't have to have an opioid medication to do that. So I think a lot of those conversations are very important to take place before the prescription of an opioid so that the patient is aware of what they need to expect.